Have you ever felt a lump or noticed something unusual in your body and immediately wondered what it could be? It is natural to feel a bit of concern, especially when it comes to something like a bone tumor. To answer directly, not all bone tumors are considered bone cancer. A bone tumor simply refers to an abnormal growth of cells within a bone, and these growths can be either benign, meaning non-cancerous, or malignant, meaning cancerous. The key difference lies in the behavior of these cells. Benign bone tumors are usually localized, grow slowly, and do not spread to other parts of the body. They might cause pain or weaken the bone, but they are not life-threatening in the same way malignant tumors are. In contrast, malignant bone tumors, which are true bone cancers, have the ability to invade surrounding tissues and metastasize, or spread, to distant parts of the body through the bloodstream or lymphatic system. This spreading characteristic is what defines cancer and makes it a much more serious condition. Medical professionals often distinguish between primary bone cancer, which starts in the bone, and secondary bone cancer, which is cancer that has spread to the bone from another part of the body, like breast or lung cancer. If you discover a bone tumor or experience persistent bone pain, it is always important to consult with a healthcare professional. They will typically conduct a thorough physical examination, order imaging tests such as X-rays, MRI scans, or CT scans, and possibly perform a biopsy to determine the exact nature of the growth. A biopsy involves taking a small tissue sample for microscopic examination, which is the most definitive way to diagnose if a tumor is benign or malignant. Did you know that osteochondroma is one of the most common types of benign bone tumors, often appearing in children and young adults? It typically stops growing when the individual stops growing, and rarely causes serious issues unless it presses on nerves or blood vessels. On the other hand, osteosarcoma is the most common type of primary malignant bone cancer, primarily affecting children, teenagers, and young adults. Understanding these specific terms can help you better discuss your situation with your medical team. Ultimately, while the term bone tumor encompasses a wide range of growths, knowing whether it is benign or malignant is crucial for understanding its potential impact and guiding the appropriate next steps. Early and accurate diagnosis ensures you receive the correct information and care, paving the way for the best possible outcome for your bone health.